Welcome to the Fitness Plus Technology Podcast for club owners, operators, and fitness professionals. Each week, host Bryan O'Rourke brings you an expert interview with a global influencer at the crossroads of fitness and technology. You gain the insights, tools, and inspiration you need to stay connected to the pulse for what matters most for your business in the age of exponential technologies.
Welcome, listeners. I'm your host, Bryan O'Rourke, and today on our pod, we have Marco Benitez, who's CEO and founder of ROOK. And ROOK is an interesting company that enables businesses, organizations, apps, et cetera, to easily process and embed data from the hundreds of wearables into a single integration, which makes obtaining that information and using it a lot easier. I really enjoyed this conversation with Marco as we talk about things like data and what the implications are for data and wearables and how that affects health and fitness. Marco has a great background, having worked in the pharma business and is a clinical research associate in pharma. So I think you're going to find his conversation very interesting. Before we get him on, I want to let everyone know I will be keynoting at Beyond Active in Singapore in early June. So be on the lookout for that event. I hope to see you there. There are some links in the show notes to help you find out about that event with our friends at Beyond Active. So without further ado, let's bring Marco Benitez on. Well, listeners, I'm really delighted to have Marco here, Marco Benitez, who's the brains behind ROOK. We're going to talk a little bit about that. Marco, where does this podcast find you today? Are you in South Florida?
Yes, I am. I'm in Naples, in Florida. So yes.
Wonderful. Love Naples. Love the place. So I've, looked at your link, and of course, in the show notes, everyone, you're going to see about Marco's company, ROOK, and what he's done, and we'll have links for his information so you can learn more. But I'm curious, what was your journey to bring you here where you're working with data and doing all the things you're doing? How did you get into business? I know you're a biomedical engineer by education. You've worked for major pharma companies. You have a very interesting background to end up in the fitness industry or doing what you're doing with data in the space. Tell us how you got here.
Yeah, well, first of all, Bryan, thank you so much for this opportunity. I'm super excited to be here. I'm fans of yours. I think we have at least probably 8 years ago. No,
yes,
kidding. Like 5 years ago, we had a very deep conversation with one of my co-founders. We have a very tough and discussion around data and all these type of things. So I remember very well. So I'm very excited to be here. That's for true. Yeah, I can start saying that my journey has been very interesting in terms of fitness, sports. That's my first passion. I'm a Taekwondoing guy. So my whole career, I started Taekwondo since I was like 5 years old. So I was very young. I'm black belt for Dan. So I was in, tournaments, all these kind of things. So for me, fitness sports represent like discipline, consistency, perseverance, be in the play, be gaming. It's like being in the mood of always trying to challenge yourself and be always the best and help and this type of thing. So for me, it's fitness and sports. It's everything. It's my values. It's in the core values of myself. I think that's a lot from my parents. They did it very well on that front. After that, I study my studies. I'm biomedical engineer. I have a second degree in biomedics. But this is my second startup, actually. My first startup, we got an exit in 2006. So we were very young. One of my co-founders, he was my previous co-founder. He was the CTO. And we were in college. We were doing crazy things, but at the same time, building stuff for hospitals. We create an algorithm for hospitals. On those days in 2026, startup was not even a word, at least in Mexico. I'm from Mexico, by the way. Here in the US, a completely different story, but in Mexico was different. So we sold our company. To be super honest, was not the big exit, but was a good exit that
Sure.
helped us also to finish our studies and do different type of things. I travel a lot. I used to travel a lot. But then for me, it was very interesting to join the big pharma. Why big pharma? Big pharma is the other big enterprise that, it's like a scary thing for some people, like they are doing drugs and molecules, these type of things. But believe me, when you are working over there, understand a lot of things. And I was involved in the clinical trials. Clinical trials, believe me, is the opportunity to engage with not engage, to save people, make them feel better, because I worked before in oncology, respiratory vaccines. And on oncology, on those days, you don't have too many options, because believe me, it's a terrible disease. And big pharma give that opportunity to, an opportunity to receive something that can help you. And in some cases, you can be saved, or you can improve your health in a very good way. So I was in clinical trials. I was pretty involved in clinical trials, in data, in analytics, helping principal investigators and different type of things to make these trials. I was involved from phase 1 to phase 4. I was between GSK, Novartis, and my last job in Roche. In Roche, I was the head of medical affairs. So I helped before to create the landscaping for the submissions to the FDA, create strategies, which countries should have a specific trial. So for me, big pharma was one of the biggest challenges, and at the same time, a lot of learnings. And mainly give me the opportunity to have two big things. One is when you have a lot of information, you can create things. But even more important, when you have a lot of data, you can improve people's lives, because data is everything. It's the oil. Everyone is telling you around the oil. The data is the new oil, but it is. You understand that if you have a lot of information, you can make correlations and different type of things. So that led me to start our new company. And yes, we start 8 years ago. It's a long journey. We didn't do this the what we are doing today. In the very beginning, we were something like My Zone. My Zone, with these big screens, your calorie burn, effort zones in real time, super exciting, and try to use the data that you are using during the trainings. So we were the My Zone for Latin America, basically. And was a very profitable. In fact, we bootstrapped that company. We had a lot of fitness clubs in Mexico and in the south of US. So it was very interesting. But pandemic hit, and when the pandemic hit, everything changed, right? So we understood the different type of things. First, on those days, we had our own wearable. So we create a heart rate monitor for the chest and another one for the arm. It was very crazy, because at the end of the day, we are biomedical engineers, so we understand how to build some type of things. So we create that for our Mexicans and Latin American people. But what we understood is basically the end user doesn't want to use only one wearable. They have their own. They want to use the Apple Watch, the Whoop, the Aura, the Polars, the Garmins, all of them. So what we did, during pandemics, we started to integrate different wearables. And that's where we saw the mess. We saw that it's very difficult to integrate them. It's very difficult to make sense of all these data, show something, which different wearables, we show different type of things. So we start to standardize and normalize all this information. And we identified a very interesting things like COVID. We have on first hand, when someone has specific behaviors and you realize that it's they had COVID. So that one was very interesting. We start to see patterns around that. And because we are, more my co-founders, they are more data scientists than myself. They started to identify these type of things, and we show that to different hospitals back in Mexico. So that's how we started. But again, with a different business model. And then we make a spin-off or a pivot from our business model, because we saw a huge potential with this data aggregation, API, integration of wearables, that part was very exciting because again, that's on our core, we love data.
Yeah, no, that makes a lot of sense. And is that in your mind, Marco, is that one of the big opportunities and challenges in data for health in general? You have all these different types of platforms and not a unified standard, and you're trying to make sense of all of it. And is that one of the biggest challenges that you see today? What other challenges might be?
Yeah, I mean, there's a lot of challenges. I think this world in data is very fragmented. We can start. Because of our backgrounds, we saw the same pattern with the medical devices. Medical devices are very fragmented, and try to understand between one brand and the other one, it's very difficult. So we saw in the same industry a middleware like us trying to make sense of medical devices data. So it's like we are doing the same thing but for different wearable, different devices, but we are and they are very profitable. So that's why there is like a common language with HL7 or fire component, all these type of things that standardize the information so everyone can use this data. But on top of that, definitely there is a lot of challenges. Something also very important that happened, for example, with the wearables data is that, or at least with the wearables, is that we start to see different type of things, trends. For example, today we know that FDA have some clearances with some wearables. For example, Apple Watch have 2 FDA clearance. So all the wearables are trying to do the same thing. You can see more wearables trying to find this FDA clearance, or even like Dexcom investing in the Oura Ring, which is amazing. I mean, big pharma, big medical devices investing in wearables. I think it's a huge thing. It's a really, really huge thing.
Yeah.
So again,
yes, especially when you look up. Yeah, I'm sorry. Go ahead. I interrupted you. Go ahead.
No. Sorry. I think I have a delay here.
No, it's fine. So like for example, AFib, right? AFib is now detected in a watch, but when you go to a cardiologist, there's still not a lot of cardiologists still don't accept the Apple data. So it's interesting.
I mean, definitely yes. You will find different type of doctors. The new wave of new doctors, they born with born with these wearables devices, and they find a lot of value. So, for example, my physician, my doctor here in Florida, he loves that I show all this data because they have at least some correlation between what's going on, what happened, temperature, blood oxygen, heart rate beats, different type of things that can help them to have a better, prognostics or different type of, it's everything. It's all around correlation between all the information that you have today and in the previous days.
Yes, no, I agree. We had a conversation about this, so I get a little controversy. I'm curious to hear your views on this, and I will be kind because I'm opinionated at times. But data, and I understand what you're saying about data, and we'll talk a little bit later about the context of data. That's a whole other thing. But insurance companies, I've seen you on some interviews talking about the benefit of trying to get other aspects of the delivery system, particularly in the United States, which doesn't truly have nationalized healthcare unless you call Medicare, what is a little bit. So these big insurers, in particular, hospital systems, tell me about what you're experiencing with that without giving away confidences around the collection of fitness data and how they may benefit from it, or what are your sentiments around that?
Yeah, I think, again, healthcare industry is changing a lot the last decade. After COVID, after all the things that are happening today in this decade, I think it's moving in a different direction. I think for now, finally, healthcare and fitness are trying to unify everything, and they are trying to find alignment. And what I can see very well is that there is a very big difference between the old medicine and the new medicine. The new medicine are more focused in the prevention rather than reactive. The past, I will say the medicine 3.0 or 2.0 is more reactive. It's a different concept, and the new medicine 3.0, it's more like let's try to find ways where you are not in that place where you don't have anything to do. So finally, that's something very important. Now, healthcare, hospitals, if they want to improve, everything has to be more preventive, right? So they understood that wellness is a very important thing. So in fact, one step back, the alignment between healthcare and fitness is the new name of wellness. Wellness is prevention. That's it. It's prevention, not only in your fitness, mentally, it's different, economical. There's too many things that it's an holistic picture from one patient or end user. So I do believe that it's changing a lot. So talking about the data that you receive from wearables in the healthcare space, they are moving remote patient monitorings. Now, big pharma are using the wearables for clinical trials. So insurance companies are doing the same thing. As always, if you go with a coin, there is a good, face and the bad face always.
Yeah.
If you go to the good face, it's like trying to make prevention more hard, like changing CPT codes. CPT codes today are very important. So CPT codes, what I can start seeing is that are moving towards the prevention side rather than the reactive side. And this is something that we are hearing a lot in different events, from in insurance and from health. It's trying to help on that front, and they are the payers. I mean, they are the ones who can move the needle, to be super honest.
But they really aren't the payers. We're the payers.
I agree with you. We are the payers, but it's like a circle, right? It's the chicken and the egg problem. Mm-hmm. It's like what was first, the chicken or the egg? Because it's a complete circle. Yes, we pay for that services, but they are the ones who pay the doctors, the physicians, the hospitals, and you receive something from them. So it's like a complete circle. And I think someone has to change that movement. And what I can see is that the healthcare industry, the insurance companies are trying to move in the preventive side, because also in the long term, they are not going to pay something. That's what I see. And it's more cheaper to pay something for the prevention side than in reactive. That's for sure. That's what I can see today. Again, we need more time. And I think that it's not going to happen in the next few months, years. Probably will take more time, but we are looking more towards this type of behaviors with the insurance companies. And I can tell you a lot of insurance companies, they have their own programs, wellness programs, trying to help in the corporate wellness, trying to help in, different areas. And those initiatives are from them. And that's like, they are testing, they are like clinical trials. They are trying to do the same thing. They're trying to collect data. They're trying to make analytics, and they try to help in some way. Again, it's the good and the bad area at the same time. I'm more towards the optimistic. I'm, and be trying to, because at the end of the day, I'm owner of my health. Sure. So I know what to do if I want to have a better, old times at the end of the day. So
Yeah. No, I agree. And I love your enthusiasm. I, of course, disagree with the tenants. I think that respectfully, that first off, you can see advertisements with oil and gas companies promoting solar, and that's all done to make people think they're not such bad people. And it's kind of the oligopolistic competition model. Insurance companies don't have much competition in the United States anymore. So they kind of make these different trials and things showing that they have good intentions. But in the end, I just don't think that there's an incentive alignment around that, because insurance companies are just arbiters between buyers and sellers of service, and they don't really deliver anything of value in the end. But I do believe that hopefully the practice of medicine evolves to where we can have a more meaningful guidance. It's just right now, if insurance companies are overseeing that, I don't think that adoption is going to come for a very long time. But I hope I am wrong, and I'm glad you're out there doing this. So tell us. So what your business Rook does is it helps connect all these data points. Is that kind of what it does through an API? What does it do?
Yes, definitely. We are the platform, the fintech industry. We are the different, I can tell different names in the medical devices
Sure.
industry. So basically, what we do, we enable any brand to use wearables data. So basically, we connect with more than 300 wearables that are outside.
Wow.
And there's a lot of companies that are trying to do something with the data
Yep.
via AI analytics. They want to do preventive things. They want to use for health scores. They are using for different areas, or with this with insurance companies in the they are trying to make a quick and smart underwriting process, engagement, or even with the fitness industry, which they are using for engagement and want to understand behaviors with the end user. So there's too many industries, or clinical trials again. Clinical trials, they are using wearables because they want to decentralize the clinical trial.
Yep.
And instead of the patient go with the physician, they can receive all the time the data from the patient, like temperature, which is normally an adverse event that comes with a lot of molecules. So yes, we long story short, definitely we are an aggregator. We are this middleware that collect the data from the end users from different wearables, and then we deliver this data to the clients.
That's awesome. That I'm sure there's a very big need for that. And so, Marco, you've founded more than one company. You've had a successful exit. You've worked in pharma. You're, impressive background in biomedical engineering. You're on the cutting edge of data. I know a lot of listeners, I like to ask this question about pearls of wisdom, because having done the things that you've done, life starts to teach you lessons about things. I can speak for that because I'm an older guy. So you kind of, as you get older, you kind of hope you get a little insight. What are some things that you've learned as an entrepreneur with startups before startups were a thing? I know what that's like. What is some advice that you give business people in the space looking to do cutting edge things like you are?
I mean, health industry, it's very interesting area. I mean, you need a lot of money, you need a lot of wisdom, you need a lot of connection, you need a lot of things. But I'm super passionate about health industry. General speaking, by the way, in 2-3 days, it's my 40th birthday. So
Oh,
I'm
happy
almost
birthday.
in thank you so much. And definitely I learned a lot of stuff. Something I realized, it's like, and it's a letter of a song. And it says that one day you will leave this world behind. So live the life
Yes.
you will remember. So that for me, it's very important. So it's like, I want to do what I can, whatever I want, and try to do a good things for people. So that, with that mind or that type of values in my behaviors, what I can tell you is that keep building. At the end of the day, this is a very difficult journey. Creates something from the scratch. It's really, really tough. And you will find a lot of no's. You will find all the time different people saying that you are crazy, that your idea is the worst one in the world. And you have different people that can let you know, and you go down. But then it's like, again, you are the one who can show to yourself that you can do something better. So keep building. It's something very important, and don't give up.
Don't give up. I think that's the most important one. Do not give up. Marco, it's been a number of years since we've spoken. I always enjoy talking with you, and I give you a lot of credit for keeping on pushing on the data theme and making all the progress and impact you've done so far. It's always a pleasure, and thanks for sharing your wisdom. And for our listeners, we'll have all links in the show notes so you can learn more about Rook, more about his story, and connect with him at your convenience. Marco, thanks so much for making time today. We really appreciate you.
Thank you so much, Bryan, for the time, and always excited to speak with you.
Hello, listeners. This is Bryan O'Rourke, and thanks so much for listening to the Fitness Plus Technology Podcast. The podcast is made possible by the Fitness Industry Technology Council, a consortium of global brands working together to enhance the adoption of technologies in the fitness space. Our company, Videri Ventures, which is invested in Vertimax, Montezuma, Gold's Gym, Houston, Texas, and Fitness 24/7 Thailand, also underwrites the podcast, along with our service companies, Integris Advisors, Moon Mission Media, and others. Please feel free to share this podcast with your colleagues. And if I can be of any assistance to you, don't hesitate to reach out, bryanko'rourke@gmail.com, or find me on any of the major social networks. Have a great day, and thanks for listening.